Good morning, everyone. I am Taylor Post, Swiftland's Office Manager, and I would like to welcome you all to today's webinar, Coronavirus, Hoaxes, Fear, and the Truth, and How Libraries Can Help, and today's presenter, Dr. Stephanie Rollins. Dr. Rollins is a research and writing specialist at the Air University Press at Maxwell Air Force Base. She is also an adjunct professor for the University of Alabama and teaches digital reference, collection development, and organization of information, among other courses. Stephanie serves on both regional and state library committees, and she has 23 years of experience in academic and special libraries. She holds a BA in English from Auburn University and a master's degree in library service and a doctorate in public administration, both from the University of Alabama. Please welcome Stephanie and enjoy her webinar this morning. Dr. Rollins?
Good morning. Thank you, Deb, and thank you, Taylor, for both being here today. Good morning, everybody. Before we get started, I just wanted to check in with you. These are definitely strange times, and I just wanted to, if you have a chance, please in the chat box, just kind of type how you're feeling. If you guys are okay, I just really want to know that everybody's doing okay, that you're safe and you're healthy, and that I'm just worried about that. So as I talk, that's something that I can look at and see and see how you're doing. So today, what I'd like to do is talk about how we can fight this the best way we know how as librarians. And for me, personally, professionally, the best way that I can fight anything that's out there, the things that I can control, are facts. So I can fight fear with facts. So that's one of the things I want to talk about today. If you would, please take out a scratch sheet of paper. There's a little quick, I promise, painless exercise that we're going to do a little bit later, and you just need a sheet of scratch paper for that. You will get a copy of the PowerPoint, the recording. If you don't, for some reason, get a copy of the PowerPoint slides, at the end I'll have my email, and you can just email me, and I will share the Google Drive PDF with you. So no worries on that if you don't get every site that I mentioned down quickly. Also, I just wanted to let you know I am a doctor. My son jokes that I don't have any patients, but I'm not a medical doctor, nor am I a psychological specialist or counselor. I'm just going to share with you things that work for me, things that I have learned, and I am an information expert, so I can find things that are going to help you dispel these hoaxes, possibly help with your fear, and just some things to remind you about how to look for the truth in times like this. So that's the plan for today. If you have any questions as we go along, please type them in the chat box. This is the formal agenda here. We're going to look at what is coronavirus, review it very quickly. I'm sure everybody's aware of it. Some sites you can go to for information. What are the statistics? Again, those can be a little bit overwhelming, and how to put those in perspective. What hoaxes exist right now? There's some automated sites that are fantastic that cover some of the major hoaxes and misleading facts that are out there. I'm going to show you a couple of those. And why focus on this truth? Why us? Why is this so important? We'll talk a little bit about that. Some basic terminology about verification, fact checking, and fake news. It's been kind of a hot topic for us lately, although it's not definitely new for us, right? Some steps for how to verify false information. I'm sorry, how to verify information that's false, because it's great to have these automated tools, but they don't always help you with things that aren't automated. And then some of the news sites that we can possibly trust. What sources can we use for libraries to prepare? I'm also going to look at some sites that do a great job of presenting information on coronavirus, but I also want to talk about how to market your services during this time, because there's lots of great examples of LibGuides of, oh, here's information on the coronavirus, but there's not a ton. I'm slowly finding some, and if you would, send me your library and I will definitely present it. But how you can connect with people. What can you do from home? Different things like that. And I'm going to show you a couple of really good examples from Florida. But that's something that I think we need to stress, not just the information about the virus, but how you can still use your library. And then throughout, I'm going to reference a ton of sites and also some training for you guys, some recorded, some live, that might be helpful to you. So what is the coronavirus? We all pretty much know a lot about this by now at this point. It's a respiratory disease. Sometimes you're not sure if you have that, or you could have the flu or a cold. Or if you're like me in Alabama, we've got high pollen. It could be allergies. So the best thing you can do is pay attention to the symptoms. If you have a fever, it could be the flu. It could be a bunch of different things. So make sure that you call your doctor first and have them kind of triage you. It looks like Olga, I'm so sorry you're not feeling good. That call your doctor first, and they can help you with that. There's also a 1-800 number for the Florida Department of Health where you can also call and get some advice. But basically, the coronavirus, we know about this. It's called corona because when you look at it under a microscope, it has a crown-like appearance. And a coronavirus is not new. It's a different kind of series of viruses. This one is new because it's different from the other ones, and that's why sometimes you'll see SARS-CoV-2, sometimes you'll see coronavirus novel, because it's very different. And Is the sound okay now? Okay, fantastic. So again, some of the symptoms, it doesn't discriminate. It's fever, cough, shortness of breath. And so, we just need to be careful during this time. The best thing you can do is stay home, cover your cough or sneeze, and make sure you clean and disinfect things. So just a little bit about that. This is a really good video that I found. There's tons of videos out there explaining it. There's some that are better for kids that are listed down at the end of my presentation. But this was 4 minutes. She's very calm. She explains it, and I think it's just a really good summary of coronavirus if you need more information. Some of the symptoms, again, we've talked about that: fever, cough, shortness of breath. Again, the things that you can do to stop the spread of germs. Again, we've talked a little bit about that. And the reason I've presented this again is to show you that the CDC has some very simple graphics that you can share with your patrons on your Facebook, on your research guides, whatever it might be, that are easy to read, don't use a lot of medical jargon, and get to the point. Some of the terminology that I've come across, I keep coming across new terms, so I just wanted to share these with you. You're probably familiar with them, but just in case, there's some terms that I wanted to share with you. Social distancing is very important, obviously, and that's deliberately increasing this physical space between people to avoid spreading the illness. And they recommend 6 feet at least. And I saw a really cute cartoon that says, keep a llama between you. So about the space of a llama. So that's something to think about. And it's also things like working from home, closing schools, pursuing online classes, visiting people on your mobile devices, and canceling large meetings. So we've experienced all of that by now, most states. Self-quarantine, people are doing this voluntarily, even if they haven't been exposed, but it really means that you've been exposed, but you're not showing symptoms. And so it's about a 14-day period where you can discover if you're ill or not. And during that time, you separate yourself, you pursue good hygiene, separate towels, all that kind of thing. Isolation is when you're confirmed or you're showing symptoms. Flattening the curve is something that I looked at in the beginning, and I was a little bit confused by it, but this kind of breaks it down for you. Basically, what it's saying is if you use those protective practices, you self-isolate, you stay home, you wash your hands, you don't, all those different things. If you use those, then you can slow the rate of the COVID-19, because what happens is if you use the protective measures, it's going to flatten out this curve here, and it's not going to overwhelm the healthcare system capacity. And if you look at this red curve, that's kind of what happened in Italy. They didn't really have a lot of practice of these protective measures. And so a couple other terms I was going to talk to you about that I've heard recently is, let's see, what else is on my list here? Shelter in place. That's come out for a lot of cities, and I'm going to paste something in the chat box for you real quick, because this was an updated list of places that had this. Give me just a second. Um, and also things like lockdown and give me just a second. I'll post it in the chat box so you can look at it if you want to. But these are, what it means to shelter in place, quarantine. non-essential businesses, different things like that. So in Alabama on Friday, our governor came out and said, we're not shelter in place. And so shelter in place means you basically don't leave your house except for essential things like the doctor, the grocery store, different things like that. And the hope is by doing these things, in addition to the protective measures of washing your hands and things like that, you can do your part to flatten the curve. Um, Yes, shelter in place for her, exactly. For us too, because that's like tornado. But I've seen the term out there, and so yes, it definitely can be confusing. But the military uses it as well. So yeah, I see your point there. But yeah, stay home, stay safe, I think is absolutely a better way to state it, definitely, whoever this guest person is. Again, it's not leaving for essential things. And so the governor of Alabama recently said that all non-essential businesses would be closed. So things like the grocery store, the hardware store, takeout food, the doctor, those are the things that are only open. And things like nail salons, things like fun places to go. Um, Bookstores are non-essential. However, gun stores are still open. So there's a irony there to me, but I totally get it. Um, so so that's just some of the terminology I've heard recently with the COVID-19, and so you may want to look into that. Yeah, Home Depot, fantastic that it's open. Another thing, if you're near a military base, some of the things you might have heard in the news are the HPCon measures. They're called health protection measures, and we are currently. I work on Maxwell Air Force Base, and I'm very lucky. I can work from home, very blessed. But we are under what's called health HPCon C, and so what that means is basically non-essential staff are sent home. So unless you're essential, and my husband's essential, so he's still out there, he's still interacting with people, which worries me. But he's in the facilities side of the base, so he's kind of responsible for any kind of facility maintenance on the base. So he's, taking care of the entire base along with a bunch of other people. So he has to stay and work. So he's an essential employee. But they also here use that it's a high morbidity epidemic or contamination. And so what this means is it's substantial. Social distance, limit meetings, socials, TDYs, which is basically business trips, shelter in place indoors, or if directed, don respirators, mass distribution of medical countermeasures if applicable. So if you hear that in the news, I just wanted to make sure that you knew what that was. The other thing is President Trump came out with these guidelines, which are pretty much in line with the CDC. If you look at this website and you look at these slides, and he just came out last night and said that it's been extended to the 30th of April. At one point, he was talking about opening things back up around Easter. I'm not sure how that was going to happen with our numbers that keep climbing, but that's something he was thinking about. But he has since extended it to the 30th of April. So if you're in a situation where you're stay at home, stay safe, or shelter in place, how do you prepare? And so this is just a real quick slide. You can come back to it if you'd like. This is what the experts say. You don't have to buy everything on the shelves. You really need about a 14-day supply of food per person. Other home essentials, toilet paper, which it is kind of low. I've looked at a bunch of sites. The sites I'm going to show you have answered all of my little questions about takeout food, about the mail, and does the virus stay on the mail, and what kind of things you need. The FDA says we're not out of food, so that's not something we need to worry about. It's just a slow process restocking. So you don't need to worry about that. You also need your prescriptions for at least 14 days, and then things that are non-prescription. Maybe you need formula or you need your allergy medicine. First aid kits are always important. And again, these are things I think, regardless. I mean, it's a crisis now, and so we're talking about all this. But for the future, I think just to be prepared, it's good to have these things around. Our water supply is great in most of our areas, so you don't have to stockpile water. But if you do need it, if that's something in your area that's not good, you need a 14-day supply. You want to have a way to be entertained during this time, whether it's physical fitness or you're taking an online course or you just get out a board game. something that's going to entertain you. Have a plan for your pets if your pet gets sick. My dog had an infection on his paw, so make sure your vet's still going to be open. What's the procedure for going to the vet? And then, long-term care for your family. I have a friend that has a kid that's in a self-care unit. And how do what can she do to help take care of her? Could she bring her food? What can she do? Or my parents who are kind of self-isolating at home because they're older and they're worried and their health is not perfect. What's your plan for your family? What's your plan for that care? Baby stuff, different things like that. This is one of my fears was picking up takeout. We love to cook, but we also still like to eat out if we can. And so, what's the implication of takeout food? So, like I said, the sites I'm going to show you have answered all of my questions that might seem, illogical, but everybody has their own fears and questions at this time. And so, a lot of the sites I'm going to show you have answered all my questions, and hopefully, they can answer yours or your patrons' questions, your family, whatever that might be. So, here's the overwhelming part that gets everybody's attention. The numbers, the statistics. And so since I've been doing this, the numbers have climbed. And for the United States, they've doubled since Friday, since I've looked at this. Um, and I'm going to talk a little bit about putting the numbers in perspective. I'm not a numbers person. I'm not a math genius like my husband. But he's pointed out, don't just look at the overwhelming numbers in red. Think about, the total recovered. Think about what hasn't been yet reported because the recovered, it takes about a month to recover from this, and the recovered is climbing. So that's something to think about. I'm going to show you these statistics live, but I just want to go through them real quickly. This is for the US. This is as of last night, and they update this twice a day. These numbers are for the Johns Hopkins University. It's another site that I gave you I think is fantastic for looking at numbers. And again, the numbers could be underreported, they could be overreported. It's really hard to tell right now, and we're doing the best we can with the figures that are in front of us. And then there's also one for Florida. So I'm going to show you these live plus a couple other places you can go to get statistics. So give me just a second. I'm going to share my screen and I will be right back. Okay, so this is, again, the Johns Hopkins University. It's an interactive map, so you can actually click on the different countries, you can click on different states, you can zoom in. There's probably going to be a little bit of a delay here, but it kind of looks like a map with the measles, but you can kind of get some numbers here. You can see the numbers for the United States. Yeah, recovered does seem very broad. It doesn't, see, yeah, exactly. What does that mean? And so I'm hoping that we'll get more information as time goes by, definitely. But again, you can look at different states. You can actually go in and look at a county. So for instance, if you wanted to look at Orlando, it'll tell you, how many are confirmed, how many deaths, how many are active. And then so by the county. Let me show you the one for Florida because I know that's probably the most important for you. And they've taken some of this data. And so somebody in the chat box, type what county you're from, and I'll look up your county. And you can actually look at the numbers by county. And it'll also give you some Lee. Okay. So you can either look on the map here and pick out your county if you know where it is, which I don't. So I'm going to go down here on the side and scroll down until I see Lee. I think it's on the left-hand side. But in Lee County, so hopefully it's catching up with me, it says there are 156 cases, and it gives you a little bit more demographic data. It gives you the age range, how many men and women, how many deaths, and how many hospitalizations. So it kind of gives you a little bit more data. Yeah, the Florida Department of Health itself has some great sites and information. Let me do Broward. I think Broward had quite a lot. Yeah, 1129. And so you can also look at the age range. And I was reading something last night that said more, and again, the statistics you just don't really know for sure, but more, it was men were hit worse than women. Has anybody else read that? And again, it wasn't a medical article, it's just something I was scrolling across in the news, so I definitely have to verify it. So again, you can see the cases here. And so if you have anybody, a family in a different county, you can go and look at that. Some other things to look at is the World Health Organization and the CDC both have situation reports every day. This looks like this is from the 29th of March, so they haven't updated it yet for today. However, you can also get some media resources. They have those colorful slides and different things like that. And this is it for the CDC. Again, very easy to use, very straightforward. You can look at what you need to know. Again, it's got a tracking map. It takes you to the Department of Health, it gives you a situation summary. And that's what that JHU is getting some of their numbers from. A different way to look at the data, this is Worldometer, and as I've been doing these presentations, I've gotten recommendations and I've looked at different sites. And what I like about this, I mean, the map is excellent, but it kind of overwhelms me. And so what I like to look at here is it's also got all the sources for the data, which is important to me. But this is right now. They've just updated this. It updates very regularly, so you'll see some difference in the numbers. So you can look at the numbers and it'll tell you how many new cases each day, how many total deaths. And deaths are not good. We know that. But it kind of, one death here, 3 deaths here, not great. But again, and you can also see the number of new cases. And then I think down further, it's got some graphs. And of course, the numbers are going up. But it's just got a different way of presenting the information that I kind of like to look at. Another site, someone mentioned to me, this is the Bing tracker. And again, you can actually filter it to a location. So this is me in Elmore County, Alabama. So we've actually got 13 total cases active. I'm sorry, that's Shelby, that's not me. Let me click on it again. So you can actually drill down to exactly where you want to be, kind of like you could with the Florida map. So yeah, so for me, it's 13 total cases. We've had 9 deaths in Alabama, just not one in my county. We're a real small county. All right, so another thing I want to talk to you about, again, this is a great article. I'm going to post it in the chat box for you real quick. And just think about how different maps are presented. Like I told you, excuse me, just one second. The maps, the way they are presented and different things like that can kind of be overwhelming. Let me post this in here. So this is just an article that kind of advises you, which map elicits more alarm, this one or this one, or this map. And this one kind of does it by percentages. And so sometimes, the way the data is displayed can either understate the issue or overstate the issue. So think about how the data is presented and think about, the total numbers and the way that things are presented, and just take that time not to just to take the numbers for what they are. We've never done that with information, so why do that with the data we're getting now? So just something to think about. Another thing I wanted to show you, if you are interested in knowing, this is the Kaiser Family Foundation, and they have a bunch of different data and different things. But one of the things that I liked about this site, they do have some of the same information we've looked at, but they've also got these adopted social distancing measures by state. And so you can see a stay-at-home order, which states have that. You can see non-essential business closures. You can see, I'm sorry, you can't see the little graph here. So it's telling you which ones are closed. It's telling you which ones have banned large gatherings, which ones have an emergency declaration, which is all the states, right? And so it's just a little bit different interaction and some things you might want to look at. I also wanted to show you that Google and Facebook are doing their part. If you to do a search of coronavirus in Google, they link you to everything CDC, which is, I think, a fantastic partnership. They link to some of the news here. And then Facebook as well has a coronavirus information center. Just these top 5 facts right here. It's going to catch up with me just a second. You can see some of the numbers here very quickly. some of the just very quick things in the news, some questions and answers, people needing help. And then over here on the right-hand side, for you guys in Florida, it would probably do whatever your county health is, your Florida Public Health, the CDC for Florida, which I thought was great. And you can follow those websites. I'm going to go back to my slides. Give me just 1 second. And we'll be back in just 1 second. Okay, so that's where you can find a lot of information about some of the sites, and this is specific to coronavirus. And again, if you'll get a copy of the slides, if you don't, please feel free to email me. Um, and one of the ones I didn't show you, didn't mention, is also the Department of Defense has got a website. So there may be some information there that you'd like to look at. Okay, so on that scratch sheet of paper, or if you'd like to just type into the chat box, um, this is your chance to name your fears, which I think is very important and can definitely help emotionally. I don't want you to feel overwhelmed, but I just wanted to talk to you about this. What are some of your fears? And I'm going to share mine. I don't always have logical thoughts either. I'm an emotional person. But what are some of your fears? Looks like multiple people are typing. And down here at the bottom, there's a link for the TED Talks, and there's a bunch of talks about overcoming your fears that might be helpful. Yes, children's safety, definitely. Yeah, you'd be exposed to somebody in a grocery store, definitely. Family, parents, absolutely. My grandmother's 93 and she already has a chronic condition, so I totally get that. Yeah, people that work in the hospital, people who are making, the respirators to help with us and everything that are in the factory, definitely. Fear, your children's fear, yeah, trying to talk to them. And I've got some things later that might help with that. Your husband getting, yeah, my husband too, he's still out there interacting with people every day on the base. And that's where we had our first confirmed coronavirus was on the base. Yeah, money, definitely the economy, financial ruin, right, absolutely. So there's a lot of things to be fearful of. These are some of mine, that we're going to be in not just shelter in place, but lockdown, that I won't be able to leave the house. That's not bad because I am in my house and not everybody has a house, so I shouldn't take that for granted. That we're going to run out of food, but that's not going to happen. The FDA says we're okay on food. Yeah, people definitely aren't taking it seriously. In the back of my head, I know this is stupid, but I see, the Walking Dead scenario. It's definitely far-fetched, but it gets me thinking. And then of course that I'm going to get it. My husband's going to get it. The people I love, my friends, my coworkers. Um, I'm just, worried about it. So, oh, okay. I'm so sorry, Frida. And I'm very hopeful for everybody that we get through this okay. And if we do the things that we're asked to do, if we stay home and use those preventative measures, I feel like we have a chance of being okay. But we do have to take this serious. So how can you deal with these fears? And again, I'm not trying to make light of them. I'm not trying to make light of the virus. The numbers have obviously shown us that it's increasing. But one of the things you can do is, stay away from that up to the minute social media notification. One of the things I talked about in the very beginning is knowing the facts, right? That's one thing we can control is the facts that we get and what we look at and how we evaluate them. Um, you know, and also looking at trusted sites, right? Trusted news. That's how you can reassure yourself is knowing the facts. Um, Create a new routine. You're used to being at work all day, and now you're home and you're homeschooling your kids and you're working full time from home. Um, you're very lucky. You're very blessed. However, what if you're out of a job? Well, you still need to take care of yourself. You still need to find a routine. Maybe that's taking an online class, things you can do. Meanwhile, you're waiting for the economy and this to subside. um, Go outside, go for a walk. I need to take that advice myself. Think about things you could do that, okay, somebody's typing in a chat box. Staff is worried. Sorry, give me just a second. Oh, I'm so sorry, Dave. I'm sure that was a shock for everybody. Yeah. Um, Again, there's nothing you can do to prevent people dying. That's just not something you can do. But you can, like I said, control a few things, and we're going to talk a little bit more about that in a minute. But if you live alone, call somebody, text, video. If you have severe anxiety, call a specialist. This picture right here, this is my grandson, and he's sniffing a fake flower, but he doesn't really, know that it's fake at this point. He's just smelling the flowers. And take time for yourself. Take time to appreciate what you do have. And I don't want to sound like I'm talking down to you, but I think it's just so important in these times to do that. There's learning is not canceled. Getting lost in a book is not canceled. I mean, that's what started my whole career. So thinking about what you do have access to right now. And I love this quote. In these times, the information is coming so fast. There's a ton of information out there. And so the challenge for us as people, as librarians, is to determine which information is accurate. And so one of the things you can do is find a few sources you trust and stick with them, right? Limit the frequency of your updates. You don't have to know every single detail every single minute. Practice a little self discipline. Maybe uninstall that news app that gives you notifications every 5 minutes. Name your fears. We just did that. We named a lot of our fears. And I'm going to talk about a way you can, an exercise in a little bit that you can do. Think outside yourself. Take food to people, leave it on their front porch. Walk around your neighborhood and say hi to people at a 6 foot distance. Think about ways that you can help. Seek support, but do it wisely because there's nothing worse than like calling your mom and her being all upset and doesn't really help you talk about it wisely. It just talks about it emotionally and kind of gives you an echo chamber. So think about someone you can talk to who is uh, who is able to talk to you, rationally. Pay attention to your basic needs. I mean, during this time, I keep seeing people post about working from home in their robe and not taking a shower, and that's okay. There's no judgment here, but you do need to think about getting the right amount of sleep and nutrition. Get outside as much as you can. There's all kinds of apps for yoga and mindfulness and all kinds of things. We live in an internet age where we have access to so much that we can do, even though we can't really leave the house sometimes. Um, Center yourself in a routine and keep your mind, and this is just going to help you hopefully from keeping your mind wandering down kind of this dark hole, right? You've got to take care of yourself. And so the key is to work towards understanding your fears and trying to put them in perspective. I know it's hard, but you don't want your fears to help you from living a emergency dance parties. I love it. Sorry, I just saw that. That's great. As long as you're 6 feet apart, right? But you don't want this to keep you from living your healthiest life. You definitely are restricted in a lot of ways right now, but you can still have a healthy, full life. Okay, so there's not a lot of great news articles going around, but I'll talk about that in a second. But this is the exercise I wanted to talk to you about. So that scratch sheet of paper you took out, on one side, I want you to write things I can control, and on the other side, things I can't control, and draw a line down the middle. And you've already talked about a lot of your fears, and you may have scratched those on the scratch sheet of paper. Those may already be able to fit under your things you can't control. But the things you can control, I can control that I'm only going to check the news once a day. I can control that I'm going to wash my hands. I'm going to control, who I let in my house, how often I leave the house, if I do at all, which so far has been once a week. What are things I can do? What can I control? And this is a strategy my husband has talked to me about since we first got together, and it's 19 years later. What can you control in this situation? So it's just a quick exercise. Hopefully you had a second to do it. If not, do it for homework. But I think it just kind of puts in perspective, one side or the other very quickly. And some people are typing. Okay, fantastic. The other thing, we talked a little bit about this, get outside yourself, focus on caring for others. Call friends or family. A lot of people talk about journaling, not just, on the computer, but actually writing it down. It kind of helps you a little bit achieve better results. Also, you're trying, it's very hard, but trying to shake off anxiety. There's a lot of things that you can do. You can watch a movie or a show, dance party. Um, oh, I love that. If you guys keep following in the chat box, I can't catch every single thing, but washing your hands is a superpower, absolutely. But take an online class, find ways to distract yourself and entertain yourself at the same time. And someone mentioned earlier that you could call if you needed to call somebody. This is a disaster distress helpline they've set up just right now for coronavirus. And so it's a place you can call and talk to somebody or text them, and it's free. So that's something to think about. So just very quickly, again, I'm not trying to make light of this issue, but there is some good news. The Abbott Libraries, this was just on Friday. They have a new test that's been approved by the FDA that can deliver positive tests in about 5 minutes and negative results in about in about 13. So that's some good news. The stimulus bill is coming through. So if you are unemployed, I know it's a drop in the bucket, but there is money that's coming for the relief for businesses, for people. There's the cases, the new cases, not the deaths, but the new cases in Italy and China are slowing. And then there's a fantastic, uh, I can't even tell you how many hundreds of sites I've seen about databases and things to do, and the Internet Archive offering its books for free. So there's a ton of information out there that, despite and also your local library, it's all free for you. But some reasons not to panic, and this changes depending on the data we get. But we do know what this is. We've known about it. Unlike HIV that took about 2 years to figure out, we know what this is. We've had a test for it since January 13. They say the situation is improving in China because the cases diagnosed is decreasing. Some people say they're not reporting. So again, the data, you just never are 100% sure. A lot of the cases are mild. However, we are still seeing deaths from it and some severe cases from it. So it's not all great. People are recovering. If you look at the recovery statistics, symptoms appear mild in children. So that's something to be happy about. Science is on it globally. They're writing hundreds of articles, and there's already some vaccine prototypes and 80 clinical trials underway. So things are going to come. I mean, it's probably going to get worse before it gets better, but we do have a lot to look forward to in terms of good news because they are going to find some things that will help us, definitely. And again, I'm not making light of this. I feel like, we need to be cautiously optimistic, but we need to remain vigilant. I really like this quote by Martin Luther King. I think it stands true today as well. We have to face these challenges and do your part in helping to flatten the curve and keep our numbers from continuing to go up. Everybody has to do their part. We have to face this challenge. Okay, so I'm going to share my screen with you in just a second, but I want to go through really quickly some of the fact-checking sites that are automated that have some great resources on coronavirus and fact-checking that. But they're also great for when coronavirus is hopefully one day not as much of an issue. You can also check fact sites there. Let me just show you a couple of these really quickly. The Snopes has like 8 categories, so I'll show you that live. Another one is All Sides, and what this does is it takes the information presented and looks at the different takes on the issue from the left, from the center, and from the right, and gives you different news stories. So it kind of gives you a varied perspective on a news topic. fact check. We'll look at, again, news that's in the politics and check the facts a little bit. World Health has a bunch of fantastic graphics. They have about, I think, 20 or 30 of these, and all these graphics can be downloaded and used on a website. But for instance, like, taking a hot bath does not prevent the new coronavirus disease. So they've got about 50 of these, and I think they're really easy, very clear graphics, good colors, and very simple. PolitiFact, they've got some different things they rate as, uh, false, mostly false, misleading, true, pants on fire. And what they do with each one of these is they go into it and they tell you, okay, is your time short? Here's why this is wrong, or here's why this is not true, or this is why this is misleading. And then they actually go through the entire article, and they also have the credentials for the people that are doing the fact checking. And then NewsGuard is a site, they actually did one of the training webinars I list at the end that lists all the different websites that are producing false or misleading information and are keeping track of those websites. Pointner's another one. They use different fact-checking sites, but they'll say, this is misleading. Again, it'll go into depth in the article and tell you why. And you'll notice one of these here is fact checked by AFP. That's another news source, but they also have a fact-checking site. And I had actually heard this one from on the internet. Something, I don't remember how I came across it, and it says that gargling warm water with salt or vinegar kills COVID-19. And at the time, I was like, well, that might, if you have a sore throat, make you feel better, but I don't think it's going to cure it. And then I went and did my research, and apparently that is absolutely false. So again, ways to check claims and facts about COVID-19. The Department of Defense, I haven't seen this come out yet, but they said they're coming out with kind of a Mythbusters site because people keep thinking that we're going to use a police kind of guard to quarantine all Americans where they can't leave their house. And there's some myths about the Department of Defense and the military that are out there. And so they're going to develop something, but I have not seen it yet. So the best thing we can do is share the facts about COVID-19. Anybody can get sick. I've seen some of the famous people come across that have died recently. Some famous people have been diagnosed, so it doesn't discriminate. It's it's thought to be low, the immediate risk of becoming seriously ill. Someone who completed the quarantine has been released, does not pose a risk to other people. That's what we know right now. We know what to do in terms of keeping yourself healthy and others healthy, and know the symptoms. So the best thing that we can do is to share the facts and to know the facts, and that's what we can control, right? So I want to put that on your column of things you can control. So these are the fact-checking sites I mentioned. I'm going to show them to you live in just a second. Let me share my screen. I'll take just really quickly. So this is Snopes. It's going to come up slowly, but what I wanted to show you is they have literally 8 categories, or actually more, looks more like 10. But things like prevention and treatments, number 2. I'm going to click on that and show it to you real quick. So this talks about, will eating bananas prevent the coronavirus infection? False. And so it gives you a rating. If it's in the news, it'll tell you that it's in the news. If it tell you if it's unproven, a blood type. And so they've talked about in the news about the loss of your sense and smell and taste, and I've actually seen this in the news as well. So they'll tell you whether or not it's false, unproven, different things. No, the Red Cross is not offering coronavirus home tests. And again, if you click on the actual title, so I'm clicking on the No Red Cross one. Hopefully this will come up quickly. And this actually says scam. So it'll tell you, this will come up here. So people describe themselves as Red Cross workers are knocking on the door of people's homes and selling what they claim are coronavirus home tests. So this is a scam, and you can see the origin of it and what happened. So again, just a really great place to kind of look and see some of those facts, verified or not verified. So I'm going to stop sharing my screen and get back to the PowerPoint because I want to talk about what happens if you don't have automated help. Then we have to go back to what we know as librarians, and that's how to become kind of a detective in terms of looking at resources. And we've done this our entire careers. And I love this quote by Hemingway because he talks about, every librarian should be kind of like a detective. We should be skeptical, right? And so how can you do that? Um, there's some terminology I'm going to kind of fly through because I want to get to some of the things that are going to help libraries prepare and different things like that. But you're checking the facts. You're making sure that you take a scientific-like approach to getting the facts and the right facts. And so we do that every day in our jobs. We've, the fake news, the false news has been really hot for us lately. It's been something we can do workshops on and different things like that. But it's not anything new. It's sensational sometimes. Sometimes it's a parody about a political figure. Sometimes it's a joke. Sometimes it's a misleading article to get you to click on so they can sell you something. But this is nothing new. We've had things like Pizzagate. You guys remember that, right? We've got, going back to the times of Octavian and Mark Antony when he did his smear campaign, and we know what happened there. World War II propaganda. We've got, the War of the Worlds from Orson Welles, which was a radio program that really scared people, but it was not true. So again, it's not a new problem. There's some terms associated with it, clickbait, where people are trying to get you to click on something, so you'll go to a particular web page and it may not be accurate information. Confirmation bias, when you look at new evidence and you look for new evidence that confirms your belief. And sometimes in times like this, it's really important to look at multiple news sources, not a million, but multiple sources so you can kind of see all sides of an issue. People definitely do disinformation where they put false information out there, sometimes propaganda by a government. Hoax, we just kind of looked at. Sometimes it's made up information or it's made to kind of misinform people. And then the filter bubble. Things are so automated today that when you log into Google or you go to Facebook, the news and the sites are filtered for you. And so sometimes we have to be careful if those are the only places we go that we don't get kind of into this little bubble and don't see all sides and all opinions of information. Even if we don't like them, we still need to be exposed to that. So just in the chat box, if you have a second, how do you feel like as a librarian that we're equipped to be on the front lines fighting for this correct information, whether it's coronavirus or something else? How are we especially equipped? And I'm gonna tell you, but I want to hear what you think. And people are typing, so that's great. And I'm going to keep going while you type, and I will mention what's in the chat box. But coronavirus is no different than any information that we've evaluated and looked at. So we know how to evaluate information. We can educate people on fake news. We can build collections and programming. Even now, whether it's a YouTube video or something, we could still do that now, even though our libraries aren't open. So we can also partner with organizations, the school, the states, and we're also advocates for skepticism. So somebody says vast amounts of research. Yeah, there's so much information coming out. We have all these access to things like research guides, to printed material, again, videos, different things we can go. We're trusted. People trust us. They come to us. And so we're definitely in that role. And so why should we focus on this? This is just a quick graphic. I only grabbed one. There's a million out there. This is from the Pew Research Center. And it says an overwhelming majority of Americans get at least some local news online. And 89%, again, statistics, take it for what it's worth, look at it, evaluate the statistic as well. But 89% you get news either from news sites, apps, or social media. And yes, everything's free. That's fantastic point, Tally. So again, 89% of people are getting their news online, and during this time period, right? And then also 1 in 4 have shared fake news, whether they realized it or not. So we need to educate our people. They deserve the truth. We deserve the truth. Sometimes it can destroy credibility, especially during this time. I've seen things people put out there. It's like, really, that's not true because I've checked on it. It can hurt people. People who looked at the information on that ingredient in fish food that can help prevent coronavirus, or so it was said, and one person got sick and one person died. So we need to teach people these skills to evaluate what they're looking at and continue to do that, especially during this time. And it can benefit us. If we can get a good article, if we can get information about treatment out there that's true, that's only going to benefit. Again, high schoolers, college students, they can't distinguish advertisements from articles. This is just a study that kind of supports that. So again, our role is very important in teaching them the truth. And I've got several methods here. If you want to come back and look at them, probably my favorite is the Escape Junk News one. This is kind of geared towards kids. This is free resources. I've got it at the end that you can actually contact them, and I think there's graphics you can download. But, questions to ask. Do the facts hold up? Who made this? Who's the source? What's the big picture? What's the context? Is it taken out of context? Who's the intended audience? Why was this made? Was it to induce fear in times like this sometimes? Or is it to educate? And how is the information presented? What's the style and grammar? A lot of times you can tell a lot by that. If there's missing words, different things like that, I'm less trustful. Another one, this is more of an academic one. It gives you a score based on each category on currency, relevance, authority, accuracy, purpose, and the links here if you wanted to download that. And then during times of crisis, this is something new I discovered. There's a verification handbook. And because things are coming out so fast, you need to have the skills to kind of verify. And this is another graphic over here about misinformation handbook, epidemics from PolitiFact, which was one of the fact sites I mentioned. And it talks about some of the things we've already talked about. Learning the basics of the disease, be wary of claims about the epidemic source, right? There's all kinds of conspiracy theories and things like that. Verify images or videos. I'm going to go through that really quickly, but I'm going to give you some sites for that. Double check case numbers, death tolls, and fatality rates. Remember, we talked about putting those numbers in perspective. Beware of attempts to downplay, which I'm not trying to do, I hope. I hope you realize that I know how serious this is. But also, again, beware of things that blow it out of the water and cause fear. Don't share prevention or treatment methods without consulting official sources, or don't try them, I would say. And look for what's still unknown. There's still so much we don't know about this virus, this COVID-19. So think about things like that. So how can you get good news? And this is a media bias chart that I really like. It's, again, put it in perspective. No site that picks things and news is perfect. But I really liked it because I feel like they did a good job of kind of trying to rate the news. And so if you look at the top, it's neutral or bias, neutral or balanced bias, and the more reliable sources. So these are some of the sites that I tend to go to. Now, again, it's not perfect. You still have to look at the article itself and the source it's coming from, the people mentioned, all the things that we went through real quickly about evaluating the news, about evaluating an article. But these are some of the sites that I go to, and they also have Facebook, they have Twitter, they have sites, they do a daily newsletter, a lot of them. And so that's another way that you can find a few trusted sites and stick with them. Maybe just look at that newsletter once a day. Maybe just look at the nightly news, and that's another way to not feel overwhelmed. Oh, that's great, Maria. Yeah, in the unbiased category. And now I think as you go through your career as a librarian, you kind of figure that out more than you do, at least for me in the beginning. But I still read things that are just for fun that I know are biased and I know that are, satire, but that's just for fun. I know it's not true news. There's a couple websites here where you can actually type in the URL and it's going to tell you who owns the site. If it has a lot of name servers, it's probably something that's bouncing around a lot and not a great site. Whereas this website checks CNN and it tells you all the sites that CNN owns. So it's a little bit more reputable. So you can see that. Verifying people. So I posted this on Twitter. I'm expert medical advice, Dr. Stephanie Rollins. Did you know that taking a bath can help cure the coronavirus? So anybody can be whoever they want to on the internet. The sites down here at the bottom allow you to kind of do a fake Twitter feed, and you can paste that places. Um, so, um, you can also make a fake person. This is Natalie S. Colon. And it goes into extreme detail, like favorite color. And I mean, it's just crazy how easy it is to fake somebody online. So think about ways you can check for people. These are some here. I'm not going to go into them. Will say that LinkedIn sometimes is a good site, but again, anybody can be who they want to be online. But there's a lot of information you can get outside of just looking at Google and professional directories and looking up degrees and stuff like that. This was a different display, this WebMe. I encourage you to check it out. It found things like from when I was in the newsletter at Samford and started my job there. Some interesting ways to kind of look at people. White pages, you can get to a certain level and then they want you to pay, but at least you can see if this person exists and if they're in that area. And then also LinkedIn, you don't even have to have an account and you can get a ton of information. I did this without being logged in on a different web browser, and I was able to find really a lot of information about myself. Um, Also, you can fake the weather and location. So during these times, if you see people faking that, that's something to think about. Here is a post that I put. Can you believe this freak snowstorm? I had to leave my car and spend the night in the library. And then here's one that I said, I can see the mountains, have a great view. So ways you can look at checking on the weather and things like location. Weather Underground has a history, and Google Earth you can check out the landscape. And so the snowstorm thing, I really did have to spend the night in the library, and that's supported again by this Weather Underground that shows precipitation on the map, on the chart here. And then I live in Wetumpka, Alabama, which is really flat, and you'll see here there's no mountains. So again, ways you can check that. There's also ways to check video and images. These are some here: Veracity, Google Reverse Image, and TinEye. And then also Amnesty International YouTube Data Viewer. Those are all ways you can kind of check to make sure where the picture actually came from. I like the TinyEye because you can sort by the oldest, and it will tell you where the original picture came from. So this one about Obama posting about immigrants is not actually true. It's actually from sending our girls home from BBC. And then the one, this is supposed to be a video of a girl skiing and she didn't know a bear was chasing her. This will break down the YouTube video into different images, and you can do a reverse image search on those. So just real quick in the chat box, how would you check to make sure this doctor really exists? And I'm going to move from this to some resources for coronavirus for libraries, for presenting information, and then marketing in our last 2 to 3 minutes. So how might you check on this guy? And G. Simmons, that's a fantastic question. And anybody who has an answer for that, please let me know. I think we just do the best we can we keep promoting these ways to check for information and try to get to as many people as we can. State Medical Board, Snopes, image search, absolutely. If you do a reverse image search on this picture, it's a stock photo of a lonely man in church. So right away, it's not him. Absolutely. So some fantastic answers here. These are some ways you can get more resources on things like media literacy, that escape news. You can get a link to the verification handbook it's more for journalists, but I think it's super helpful for librarians, and it's also free. Okay, so what I want to do now is I'm going to go live. I'll come back to this and go through these really quickly. But yeah, you could do a search for his name and address. Absolutely, Nicole. But I want to show you a couple of these. I'm going to talk about them real quickly, and then I want to kind of show you. So there's sites, and again, I'm not doing 50 million sites. I'm doing sites that list other sites. So you kind of have a hub of information. But there's sites to help libraries prepare, or if you're caught in the middle of this right now and you're still trying to prepare, there's sites for really good examples of presenting information either in a research guide or a blog. And then there's some sites on how to kind of promote services, and specifically in Florida. So I want to show you those things. These are some resources that I talked about again to help you prepare. This is from the National Libraries of Medicine to help public libraries. This is second one is from the American Library Association. Library Journal's got some great articles under it about coverage, like how to disinfect things, what do you do. There's some fantastic things on that site. There's a fantastic librarian's disaster planning and community resiliency guidebook that has some policy and some different guidelines and documents. The Public Library Association resources on COVID-19. This information for Oregon libraries and this one for Massachusetts. I think I'm going to show you one of those in my demo, but they show it's for libraries, how libraries can prepare and things that libraries can do. So I'll show you that in just a second. And then how libraries can market, some questions to ask, whether libraries decide to stay open or close. I don't believe there's any Florida libraries that are still open, but I could be wrong. But what you could do if you have time, I started to keep a list and I was going to share it with everybody, but it just became too much. This library responses to the COVID-19 pandemic. This is a Google Doc that you guys can update and you can put your library on there. And that way people can know if you're open or not. So it's a huge document that can help. There's the Connecticut Library Consortium. On the other end of the spectrum, what do you do to reopen? Which I hadn't seen yet, which I thought was great. And then there's Facebook groups, Library Think Tank, the librarians are champions of healthy communities, libraries and social media. Sanity Matters is a great place to go to. Everybody posts like every 5 minutes or so, it seems like, about different activities and advice you can go to. There's a Learning Librarians, which is a place for school librarians and teachers. Also, there's some things to help academic and school libraries prepare. I'll show you that in just a second. Also, there is a way to look at resources for education and companies offering free subscriptions because schools are closed, and that's the Amazing Educational Resources. And they also have a Facebook group. So in terms of finding free sources, things to do for kids, also for adults sometimes too. And then also what I wanted to talk to you about there, I mentioned earlier, there's different ways to talk to your kids. There's a comic, there's a PBS thing that you can look at. Also, two school librarians created a plan, and this is an article on that. And then this Brain Pop video for kids, it helps educate kids and alleviate their fears. It has games and lesson plans. But I wanted to mention this homeschooling guide created by Florida Atlantic Universities, and they try to provide a lot of free information. And then Zoom just offered free tools during this time for K through 12 schools. That might be something you want to look at. And then the next things I'll show you are some really good ways that people have presented information guides. So this is a Google Doc list of LibGuides. So if you're trying to put together a guide on what is coronavirus, what sites should you go to, this is a Google Doc of all the libraries that have done research guides. Now you can also go to the LibGuides community site and you can search for guides. And you can do that by type of library. So you don't have to reinvent the wheel when you're trying to present information out there. You can look at what other libraries have done, and that's just going to help you. All right, and then very quickly, so again, these are some other guides that present information on coronavirus. I'll show you one of those. And if you don't have research guides, you know, there's some articles and things, blog posts, examples that you could do for your library. So I just want to talk about this very quickly, and then I'm going to go live and show you a couple of those sites. And actually we're a little bit over, but if you give me just about 3 or 4 more minutes, I'll show you some of the sites that I think are going to help you. And again, you can come back to this PowerPoint. So I've seen a lot of sites that promote information about coronavirus, but I don't see a lot of sites that say, hey, we're still here. We can help you. The library can help. You can still stay connected. I've seen a few, but not a ton. And so if you see one, please send it to me. I'll add it to my slides. And again, I'm looking first at Florida to find sites so you have as an example. but think about how you can still stay connected. And it's not that we haven't done these things before and that, this is not new. It's just kind of reminding our patrons about the things that we offer, that we have, that we can just have them continue to use. For instance, the Florida Electronic Library, or webinars, or teaching things, streaming video, our ebooks, our databases. They can get live chat with the library. So those are things that you can look at. Do a virtual tea, Downton Abbey tea virtually. How do use your social media, your Facebook Live, or if you can't caption it for some reason, that was some problem that somebody else had, record it to YouTube afterwards, and it'll do the captions for you. So think about things where you can still keep connected with people, like streaming story time, different things like that. So what I'm going to do is share my screen and just kind of quickly show you um, some of the sources, and then these are some of the libraries. USF Tampa Library. Okay, I'll make a note of that. Fantastic. Thank you. So I'm going to share my screen real quick because I want to show you, again, places you can get help, information guides where they talk about what coronavirus is, some good examples, and then how to be connected with people, how to still offer services, like learn at home, visit the library from home. So I just want to show you a couple of those very quickly, and then we'll end the session unless you have any questions. So give me just a second. I'm going to share my screen. Okay, so we should be back on my screen. So what I want to do is show you very quickly. So a couple of guides that public libraries put out and American libraries. So this is a guide for public libraries, and it talks about different things you can look at, things from the National Institute of Health, things that might help you. Another one is that I really liked was the pandemic preparedness. You guys have probably seen this one before. But again, they list news, library responses, things about your own library policy, some professional development and training resources, resources from ALA. So it's a hub of information, which is something I really like to provide instead of just one link at one after another. Another site is this is the one I was telling you about, how other libraries are providing information for other libraries to prepare. And so it gives you, some resources for responding, some webinars and training, how to offer remote library services. I'm just clicking on that really quickly. So things you can do, make a video about how to access the library digitally, dial a story option. So some things to help libraries still stay connected. Self-care and work, economic impact resources. So things to help, libraries, librarians, and your patrons. And then I like this one. I thought it was very optimistic. This is the Connecticut Library Consortium, and it talks about, that plan to reopen your library. So I think that's something that we can have in the distant future and look forward to. And what do you do when you have to reopen? How do you sanitize things? So I think that's an important thing to look at. This is some academic resources because most colleges have gone completely online. And how do you offer services? How do you learn how to do that? What's the training you can get as an academic librarian? And so again, there's some resources here. And again, this is another website. This is Alta, and it also talks about information for libraries, supporting online courses and other resources. So again, for academic libraries, possibly public libraries, school libraries, some articles and different things to look at that might be helpful. Bringing your courses online, resources to think about online. And then how can you provide information and resources? What does that look like? So this is from the Department of Education. So it might be helpful for school libraries. It's got some administration guidelines that might be helpful. Let's see, scroll down a little bit. So again, information's for schools. And then this is the guide I just wanted to show you really quickly that's done through Florida Atlantic University on homeschooling, which a lot of us are doing right now. And so just a guide here on different things. They try to keep everything free. Um, Another guide here is the page for the amazing resources that has all the free stuff or partially free or mostly free stuff. The companies that are offering things free. So I can't tell you how many times I've seen that 12 museum virtual tours post come through, but this tries to organize it kind of all in one place. And so if you have a suggestion for a site, you can put it there. And there's also a Facebook group that you can join. And then I just wanted to show you in terms of research guides, this is the LibGuides community. It's going to come up in just a second. And you can actually search on the word coronavirus and click on search. And it's going to let you limit by the types of libraries, whether you want an academic, public, hospital, government, law firm. So if I say, for instance, I wanted a public library, it's going to limit it for me to coronavirus guides from public libraries. And they even have different languages. You can filter by tag, by guide type. So again, you can get something that's going to help you create information without having to reinvent the wheel. And so this is a coronavirus guide that's just presenting information. It's going to come up in just a second. And again, what I like about it is it uses that map from JSU. So you can look at that. And then it just gives you some basic information, a lot of white space, not a ton of text, a little bit of text, but not a ton of text. And it's for California. So it gives you some really good sites there, again, in terms of you presenting a guide or research information for your library for your patrons. Okay, so one other thing I wanted to show you. Okay, so in terms of Florida, and this is about the last thing that we'll do, in terms of Florida, it can be very simple. So this is the University of Central Florida. And all they've done is said, here's some academic resources during this COVID-19 situation. Very simple, to the point, very nicely done. So in terms of an academic library. So not just presenting information on the coronavirus, but also showing how they can stay connected and still get help with research. Another one I really like is the Hillsborough County. I don't know if we have anybody here today with Hillsborough County, but I love this image right here. Visit the library from home. Open 24/7 for you. Learning and fun for all ages. So even though they're closed, the message they're sending is you can still get connected to the library. So I think that's a great job. Another one, and again, I just have a few. So if you have one, please let me know. Another one is through Nova Scotia. Yeah. Do I have that right? No, sorry, Nova Southeastern University. So I thought this was a really great one, Learn at Home, and they've got, the different kind of teachers here. They've got things for Broward schools, Learning Never Closes. What a great concept. And they also have free online resources, author and illustrator visits, virtual field trips. So again, not just information on the virus itself, but how to get started to learn at home. For teens, do-it-yourself story time, STEM, teacher resources. And then one last one is it's the Borland Library at the University of Florida. And it is a really great one. This come up for just a second. So they say our doors are closed, but our services continue. And then they also offer the COVID-19 resources. So how can you get services during this time? So just thinking about the approach of we've always done this, but reminding people they can, just because they're at home, they can still use the library. So I'm going to stop sharing my screen to see if you guys have any questions. Oh, that's your library. I'm so glad I've met somebody from a library that I actually demoed. Okay, so let me share the PowerPoint real quick. And I will definitely check out USF, Joanne. Borland, okay. And just really quickly, I just want to share some training that's available for you. And then this is available in a document. The other thing I forgot to mention, I just found this last night. For Alabama, there's a fantastic article called Libraries Online Treasure Trove Shine During Shutdown. And so I think it's very helpful to have some PR or some information on, hey, here's everything you can do through our libraries. And that was not, that was just on alabama.com, which is just kind of a general news site about Alabama. There's some other guides here that I really liked for youth and again, for libraries themselves. But let me just show you real quickly. I'm going to paste it in the chat box in case you have to go right now. But these are, this is a list of all the training in one document. But there's some training that's still available. I'm just going to kind of page through this quickly. And again, you can look at it. And then there's some recorded stuff. So if you do have time right now, and again, moving forward, we'll be cautious, have cautious optimism, balanced with skepticism. You know, we really just have to know the facts, use the strategies, some of which we've talked about today, some you already definitely know in your career. Fact check. Don't just think about one source, consider multiple sources. Verify as much as we can, and then share these skills with people. And you know, hopefully I look forward to the day when our libraries will reopen. And hopefully that's something that can happen. And I thank you so much for your time. I'm quite a bit over. I apologize. The PowerPoint has more information and sites you can check out. Especially that's definitely a way to distract yourself and learn is to look at some of these sites. If you have any questions, please let me know. Don't hesitate to type in the chat box or contact me directly. Again, sorry, I'm quite a bit over, but if you have any questions, please let me know, and I'll continue to update this presentation. Thank you so much.
Thank you, Dr. Rollins, for an informative webinar this morning. Attendees, if you enjoyed this webinar, we do have one more coronavirus webinar scheduled for April 1st, and it is full, but if you would like to snag a seat on the waiting list in hopes that you might get a spot, you're more than welcome to. As always, we encourage you to keep an eye on the Swiftland CE calendar, the Swiftland Facebook page, or your message from the listserv. Thank you everyone for attending, and have a great rest of your day.
Thank you so much, everybody.